Hi everyone, I'm Lisa Gillespie, craniosacral therapist and restorative exercise specialist. Today we're going to do some foot TLC. I'm going to show you 3 things that you can do to help counteract the effects of a night in shoes that weren't ideal for your feet. Also known as how to cure the high heel hangover. Although guys, you're not immune to this one, so pay attention. You will need a tennis ball or some type of a ball. This is a yoga tune-up therapy ball, which I like. You will also need a half dome. If you don't have a half dome, which a lot of people don't, you can use a rolled up bath towel as well as a rolled up yoga mat. Another thing that works well is if you have a book that is about 3 inches thick, that will also work quite nicely. So we're going to start off with the ball, and we're going to place the ball underneath the ball of the foot. So we're just going to gently drape our foot over the top of the ball. And you're going to, if you need to hold on to a wall, you can do this. Also, if your feet are really tender, you're welcome to do this seated, and that will help take some of the pressure off. So we're just going to drape the foot over the ball, allowing the ball to deform the underside of the foot. And then we're going to roll the ankle side to side gently so that we can gently massage with the ball underneath the ball of the foot. Now keep in mind, if you have a tendency to have really unstable ankles or hypermobile ankles, do this gently and mindfully so that you do not risk injuring your ankle. And then we're going to move the ball a little bit further back. So now we are right around the arch area of the foot. And again, we're just gently rolling the ankles side to side, giving those tissues some nice TLC, some massage. We're improving the circulation to the area. We're increasing the mobility of the joints in our foot. We've got 33 joints in our feet. And when they are shoved in shoes all day long, they don't get a lot of opportunity to move. The last thing we're going to do is move the ball down to just in front of the heel. And we're actually, I'm going to turn sideways so you can see a little bit more easily. So the ball is just in front of my heel. I'm actually going to shift so that I'm putting the ball of my foot down and raising my heel up. And I'm just going to shift the heel side to side as if I were trying to smush out an ember, or if you smoked, if you were putting a cigarette out, this is the movement. And you're just helping those tissues in front of the heel. We've got a lot of things that attach right in that area. They're helping improve the circulation and mobility of those tissues there. And then we're going to roll the ball from the ball of the foot down to in front of the heel, and we're going to do 5 tracks. So we're going to start with the big toe, and we're going to roll down the path of the big toe, or the foot that's in line with the big toe, and then the second, the third, the fourth, and the fifth, so that we finish with the outer edge of the toe. So we start at the ball of the foot, and we're just tracing the path from the big toe down to in front of the heel, and you're just bringing that front to back. You can control the weight, how much weight you want to put onto it, and as I said, you can also do this seated. You can do 2 to 3 passes in each area. Now we're going to move to the path of the second toe, and we're just bringing the ball from the ball of the foot down to in front of the heel. And then down to the third. So we're just covering the whole underside of the foot. And then down to the fourth. And then we'll finish up with that outside edge. All right. And now before we move on to the second foot, I just want you to stand and notice how the foot that just got the treatment feels compared to the foot that has yet to get some attention. And what do you notice? I'm feeling that my right foot, which is the foot I just worked on, feels like it's making more contact with the floor. It feels softer. It feels like my left foot is more tense and rigid compared to my right foot. So just make a note of that. And then we'll come over to the left or your second foot, whichever one you didn't do yet. And again, we're just draping the ball of the foot over the ball. And we are gently rolling the ankle side to side. Again, be mindful if you have mobile ankles or a history of ankle injuries, do this very mindfully. Nice and gentle side to side. You may notice one foot is more tender than the other. That would be totally normal. We're going to move now to the arch area. And again, rolling side to side. We carry our body weight. We tend to carry our body weight more on one side compared to the other. And we also do things, we're not symmetrical with our movement habits. And then the last one will move just in front of the heel and we'll shift so that now you're putting the ball of your foot down and you're shifting your weight. You're kind of twisting the heel side to side. As for this one, you're keeping the ankle stable, so you're not rolling in and out. You're just rotating that area of the foot around the ball. And then we're going to do the strips from the inside of the foot to the outside of the foot, making a track for each toe. So starting at the ball of the foot and rolling down towards the heel. You get to decide how much pressure you want to use. The ball that I'm using, I've been using for a few weeks, so it is more broken in and soft, depending on the firmness of the ball you're using, whether it's a tennis ball or a racket ball or something else you have handy. You may notice that you have to adjust your pressure accordingly, so please do so. All right, second toe, if you haven't already. I moved ahead. And then we'll move to the third toe. And again, we're just doing this to help mobilize the tissues, the fascia, the joints. And now to the fourth toe. These poor feet don't get an opportunity to move freely very often. And then lastly, we'll do the outside edge in line with that fifth toe, the fifth metatarsal. All right, so now stand and just notice how different your feet feel compared to when you began. So I have two other things that I want to show you. The first thing we're going to do is the calf stretch. So you'll use your rolled up towel or yoga mat or a book if you don't have the Half Dome handy. You're going to place the ball of your foot on whatever you're using. And you're going to keep the heel down. Both legs are going to keep the knees straight, so we don't want to bend the knees. And then you're just going to move the opposite foot forward, the foot that's not on the prop. And you're going to move it forward enough that you start to feel a gentle stretch in the calf. Anytime you wear shoes that are elevating the heel more than the ball of the foot, which is pretty much just about any shoe that we wear these days, unless you've been very intentional about buying shoes that have a completely flat sole and no elevation under the heel. It's not just what we typically think of as high heels. Anytime we wear shoes that elevate the heel more than the ball of the foot, we're shortening the calf muscle. So with this stretch, we are creating a little more length through that calf muscle. And just be mindful as you check in here. Are your feet pointing straight ahead? So if your feet are turned out, which they tend to be when we walk, most of us, many of us have a habit of turning the feet out when we walk, even slightly. And that changes the arrangement of the muscles so that when we do this stretch, if our feet are turned out, we're not accessing the calf muscle as directly as we would be if our feet were parallel. And then we'll just go ahead and change to the other side. Again, putting the ball of the foot up on the prop of choice and moving your opposite foot forward. I'll actually turn this way so you can see a little better. And just notice, you might notice a tendency to shift your body way forward. See if you can be mindful about keeping it backed up and keeping your pelvis stacked over your back ankle, so that if I were to drop a plumb line, I would have the plumb line be traveling the path of the center of the hip through the center of the knee through the center of the ankle. And the tendency for a lot of people is to shift forward so that they can get what feels like more stretch, but in the process of doing that, you're compromising some other things. So we want to be mindful of, we're just creating a little bit of a stretch. We're not looking for a huge stretch. We're just treating these tissues gently and inviting them to lengthen. All right, and you can repeat that too. For the purposes of this video and for the sake of time, I'm going to show you the last stretch that you can do to help undo the effects of the heels or footwear that you've worn. We're going to stretch the top of the foot. You can do this seated as well as standing. I'm going to show you standing. If your feet are really tight, if you have a history of wearing tight shoes or heels for years and years and years, you may find it more comfortable to do this one seated. You also may notice it's not uncommon for there to be some cramping in the foot during this stretch. If you feel cramping, by all means come out of the stretch, relax the toes, stretch, do what you need to do to relieve the cramp, and then you can move back into it. The cramping is really a sign of the tension that you hold in your feet. So gradually working yourself into doing it more frequently would probably be of benefit. So for the purposes of standing, or of doing this stretch standing, we're just going to shift our weight to one foot, and we're going to drag the opposite foot back behind us and fold the toes underneath so that the top of the ankle, and I'll show you from the side, so that the top of the ankle is being gently stretched, the top of the foot, I should say, is being gently stretched towards the floor. We're not looking to force the top of the foot down to meet the floor. We're just looking to create a gentle stretch with the toes folded under. You may notice that you have a tendency to shift your weight forward. As much as you can, keep the weight stacked. Again, the pelvis stacked over the knees, stacked over the ankle. And your weight equally divided between your left and right. So if you catch yourself having all your weight over on one side, see if you can, A, stop collapsing through the hip, and B, shift yourself so that you've got your weight evenly distributed between your left and right legs. And as I said, it would be totally normal for you to have some cramping in the foot as you're doing this, and just come out as you need to. All right, and we will shift to the other side. So again, we're shifting the weight to one foot. We are dragging the other foot behind us and gently folding the toes underneath to allow the top of the foot to gently stretch towards the floor. You're not forcing anything to happen. You're respecting your body's boundaries. Also be mindful as you do this, check in that your heel hasn't collapsed out to the side. We want to keep the heel in line with the toes. If you tend to have ankles that maybe have rolled easily or feel less stable, you want to be really mindful that you maintain the stability in the ankle as you do this. And as I mentioned, you can also hold on to a wall or a chair. And by all means, if you need to do this seated, it decreases the amount of weight that you place on the foot. So doing it seated can be a nice way to progress up to standing position. Also, the more that you bend the stretching leg and the closer you bring the stretching foot towards your opposite foot, the more you decrease the weight or decrease the stretch. So that's another way to gradually progress as you do it, is by moving the foot further back. All right, so there are 3 things that you can do to help care for your feet, give them some TLC for all the hard work that they've done, and if they have been in less than ideal shoes, especially during this holiday season, I encourage you to take a few minutes and give them some care and attention. Enjoy.